Hi, I'm Dr. Michael Lyon. I'm the medical director for the Medical Weight Management Center, and it's been my long-term goal to see individuals who are really struggling with their weight, often with very serious problems that accompany their weight, that those individuals have access to compassionate, thorough, and evidence-based care. So in the Medical Weight Management Center, we have adopted an approach to dealing with significant weight issues that has been developed by the Canadian Obesity Network. It's an approach that we call the 5 A's of obesity management. Now, this is an approach that's being taught to family physicians, internal medicine doctors, medical doctors in training. It's beginning to become part of this medical school curriculum, and it's an approach to dealing with obesity that is much more than just about some sort of simplistic weight loss program. In essence, what it does is it realizes that the effective approach to treating obesity has to begin by, first of all, understanding whether the patient is really ready for change. Because unless you really have an inner sense that you need to change, that you need to reduce your body weight and begin to correct some of the problems in your diet, your lifestyle, maybe emotional relationships with food and so on, until you're really ready, there's no use, for instance, a doctor wagging his finger at you and saying, just lose weight. It's of no value at all. It just compounds the guilt and the remorse that a lot of people experience when they're struggling with their weight. So in a doctor's office, the doctor should be very careful and sensitive to, for instance, just ask permission as to whether it's okay to talk about a person's weight. And, in our clinic it's a little different because people are referred by their physician for weight management. And so, in essence, most of the patients here, they're already ready. They're ready for change. They want the change. They're really at the point in their life where they know, maybe because they've got some serious health issues or mobility issues or pain problems, they know that they have to get their lifestyle in order and they've got to lose some weight. So the second step in the 5 A's is to assess. It means that rather than just diving in with some sort of diet plan and helping the person lose weight, the right thing to do is to begin by thoroughly assessing the individual, first of all, in terms of their medical circumstances. So in our clinic, the initial assessment is conducted by an internal medicine specialist. It involves the gathering of a tremendous amount of information so that before we even see the patient, we already have gathered so much information about them that we probably know more than any doctor that's ever seen them. And that thoroughness of understanding who that person is, how did they gain weight? What are the barriers that are going to stand in their way? This begins to be kind of like the pieces of the puzzle that comes together for that individual. And then we also have to understand how has weight affected them. Has it affected them medically? Are they diabetic or pre-diabetic? Do they have cardiovascular risk factors? Do they have pain or mobility issues that could be related to their weight? Do they have some serious complications of weight gain like sleep apnea and so on? So the assessment process is very important. It sets the stage for us being able to understand how to deal with that person and treat them as an individual. So the assessment process here at the Medical Weight Management Center is exceedingly detailed. And it doesn't just stop at medical assessment, it also involves understanding a person's emotional well-being, their emotional relationship with food, if you will, the stresses in their life, whether they're troubled by depression, whether they're troubled by elements that suggest an addiction to food or a binge eating disorder. These are the kind of things that can make or break the long-term success of weight management. The next thing that we look at is advise. So in any doctor's office, when a patient usually is well known by the family physician, for instance, and the doctor wants to advise them as to how to go about with changes that are going to bring about weight loss, you have to really advise the patient based on their real circumstances. So for instance, if you have a heavier patient, But when you thoroughly examine them with blood tests and physical exam, and you look at how mobile they are, and whether they have any limitations because of pain and so on, you might say, this is a heavier person, but for all intents and purposes, they're pretty healthy. And so that puts weight management into a different perspective. If the person is heavier, but they're not medically afflicted because of their weight, and they're in good emotional health, and they have strong self-esteem and confidence, and they're physically fit, and their diet is relatively good, it could be that reassurance is part of the approach to advising the patient, that not everybody that's heavy needs to feel like somehow their life is threatened, because it isn't always. On the other hand, in some cases, individuals perhaps that haven't even gained that much weight already have some very serious weight-related issues we call comorbidities, things like diabetes or sleep apnea, early osteoarthritis, that sort of thing. They may have some tremendous burdens when it comes to how they feel about themselves personally, their confidence, their self-esteem, their body image. And the advice that you give might be something that's tailored, dependent on their circumstances, quite differently from one person to another. The next step in the 5 A's, or thing that we work on, is we agree with the patient on realistic weight loss goals, expectations. And oftentimes, if a person, for instance, asks their doctor, what should I weigh, doc? The doctor will pull out a BMI chart and point to a magic number. Usually it's 24, because that's supposedly the ideal weight. You can say in a general sense, as you're growing up and you're wanting to know what your weight should be, that's a fairly reasonable number if you're not a heavy person. But once you've gained an exceptional amount of weight, that no longer is realistic for most people. And again, we're reflecting on the evidence from science that if you look at 100 people who have gained a substantial amount of weight, a very, very small percentage of people will ever achieve and maintain an ideal body weight again. That is, a BMI of about 24. So we have to adjust our expectations and our goals differently. First of all, a big weight loss goal is not really a goal, because it's just too big. You can't really say that's a goal. A goal is something that really has to be broken down into small steps, doable pieces that become actual behavior changes, or changes in the lifestyle or the diet or the emotional relationship with food or how you handle stress. These are things you can change that are very tangible. We actually try to help people develop SMART goals that are definable, where the individual steps can be laid out in front of someone, so that in essence, when you have someone who's working towards change, you're agreeing with them that there should be change, you're actually helping them to begin a journey that is going to go on for the rest of their life. It's not something that is all about some sort of end weight. Even though there are situations where it would be ideal, because of health and mobility and other reasons, that someone should lose a significant amount of weight, it's still necessary for people to go about this by making smaller goals and achieving small steps towards the completion of this journey. So that's really the agree. What is a person's ideal weight? Their best weight, if you will. It's really going to be the best weight that they can achieve and maintain while living the healthiest lifestyle they can truly enjoy. That's it. So it's not necessarily going to be a certain BMI for everyone. It's going to be the healthiest weight that you can achieve and maintain long-term while living the healthiest lifestyle you can truly enjoy. So if we can help you to learn to enjoy a much healthier lifestyle, and that would be a lifestyle that might be less food in terms of calories and so on, then you're probably going to end up a lesser weight, maybe a fairly substantial lesser weight, but it might mean that you have to set your goals a little differently. You've got to start off by setting expectations that are achievable. And then the final step in the 5As is assist. This is where a doctor, in our case, our program, assists you in dealing with the things that resulted in weight gain in the first place. We call these the drivers of obesity. Really, what is the foundation underneath this weight gain? Was it something that is still in your life? So for instance, if you are on a medication that resulted in 50 pounds of weight gain, if we don't address that medication in some way, hopefully by finding an alternative to that medication in many cases, then that's still a driver for weight gain that's going to remain. It might be a medical condition, for instance, sleep apnea. It's like a real vicious cycle. You gain weight, you develop sleep apnea. Sleep apnea leaves you exhausted. It results in hormones that drive eating behaviors. It results in those hormones going up. It creates inflammation in your body. It makes you feel more pain and stiffness. It really is not an optimal situation when it comes to getting your lifestyle in order when you're suffering from sleep apnea. So this is a big driver for weight gain, and it can be a barrier in the way of long-term success. So assist often results in, or it often leads to us, because we've really assessed the person and we understand them better, we start to understand the things that have actually led to their weight gain in the first place. And if there are things that we can change that are barriers to their long-term success, those are the most important things. It's not necessarily about the specific diet that they're on. But assist can also mean helping them with a diet that results in weight loss, a calorie-controlled diet, maybe a very structured diet, meal planning and portion control, and learning how to eat correctly when it comes to things like protein and glycemic index and eating to feel fuller with less food. These are all very important things that are, it takes time, and it takes a lot of education, and it takes a lot of practice, and that's why our program is very thorough. We have dietitians in our practice, and we have, real practical sessions where we even teach meal planning and food preparation, and we get people tasting food, and we make it very practical. So the assist is something that for our program is assisting them in really hundreds of different areas of their life. If it was a family doctor, it might mean assisting them with a referral to a program like ours, or maybe referring them for potentially bariatric surgery, or potentially assisting them by giving them a prescription for a medication that help support their weight loss, and so on. So the assist is something that is, it's sort of a never-ending process, like most of this. Again, the 5As: ask, assess. Assessing is something that we continue to do as time goes on. We may realize that this is an individual that has maybe some mental health issues that aren't being fully addressed, so we might actually do more assessment in that area. Or it could be that you're lacking in skills in terms of food planning and preparation, so you might be given more assistance in that area. Or you might be lacking in the understanding of how to engage in physical fitness, so we have experts that help you to do that. Again, advising in terms of really what should your goals be, and what are your risks if you don't change and lose weight and keep the weight off. These are all parts of the 5As, and then agreeing on realistic goals, and assisting you in actually achieving the goals that you've set out to achieve in the first place. Going about this in a more orderly fashion, where we use the 5As as sort of a guidepost or a roadmap. It really, in the end, it may be a slower process in some ways. It's not like a crash diet where you're going to dive in and the weight just comes off, melts away. It doesn't mean that some people don't lose weight pretty quickly. Some people are ready for that, and we can help them. But in other cases, it means that you're going to go about this in a much steadier, slower process. It's more like helping you build a foundation first. And in the end, I think you're going to achieve more substantial goals in the long term.